I'm going to invite our managing director, Viola Nachide, to speak to us. And shortly after, she'll in turn invite, she'll speak to us, and shortly after, she'll in turn invite the Uganda Medical Laboratory Technology Professionals Association, who are our partners. Yes, you're very welcome, Viola. Kindly please speak to us.
Thank you very much, Precious, for those remarks. You are welcome, everyone, to this internal quality control webinar. We are glad that you're here on time. Now, basically what I'm going to do is introduce who we are and go ahead and invite our partner, the president for UMLTA, Mr. Eric, to take us away. But about VIQAP, who is VIQAP? These are just some of the housekeeping rules that Precious has already talked about. About VIQAP, who are we? We are premium providers of specialized both training and consultancy services. We basically do quality management trainings, we do risk biosafety management trainings, leadership trainings, in the areas of health, that is in health systems, but also in just management of different organizations. So the reason as to why we entered the training space is we realize that some things can just be merged by just improvement of knowledge. Sometimes you are not able to do certain things just because you do not know. And that's why we bring to you trainings like this. They'll be technical, they'll be more managerial, but we try to identify the gaps and bridge the gaps. VIQAP has been in existence officially since 2022, so that makes us about 4 years in. And we work with a series of different trainers, people who have been certified in the different areas of training that they offer. So we bring them to you so that they're able to share what they've learned and how they can assist us to improve from where we are to where we are going. So I work, like I mentioned, we have trained, okay, that was 120 by 2025, but we have certified many individuals, both laboratory professionals and non-laboratory professionals in areas of biorisk management, leadership, internal audit trainings, ISO 15189, ISO 9001, and we have also worked with certain organizations in helping to improve their quality management systems, and some have also attained accreditation. So we also come in, we have a team of experts who come in your laboratory depending on what your needs are. Is it accreditation, or do you just want to improve your services? So if that is something you are looking for, you can reach out. Some people are usually scared that the budget is going to be so high. Usually that's not the case, because what we do client-tailored, solutions. So is it training that you need? Our trainings, we have a number of trainings that we are bringing on board, and we shall be letting you know that are internationally certified. Okay, we also have trainings that are nationally certified in Uganda, and we also have trainings that are awareness training. So depending on what you want to know, we can be able to move with you. Now, some of us are very busy, like quality managers, supervisors, but there's always that training you've always wanted to have. There's some knowledge you've always wanted to have. And for some reason, when mass communications like this come through, or when we organize mass trainings, you feel like you're left out, we also do personalized trainings one-on-one with you, depending on the mode of availability you are. So we look at your schedule and then we work with you. So we have put in place all these things to ensure that the goal and the mission for VIQAP in the area of training is achieved. So another thing I wanted to let us know, we have already talked about some of these services. The core right now is ISO 15189, which is the standard for quality and competence for medical laboratories that every laboratory professional must have. We do ISO 9001, that is for quality management. This is for managers, quality managers, and anyone who, entrepreneurs, founders, anyone who wants to be, who feels like they are looking for managerial role. 9001 is for you. Then this is ISO 19011, supposed to be 911. That's for internal auditors. Then the 35001 for biorisk, biosafety. Laboratory leadership, management. We realize many of us go into leadership positions without, without any certificate, like you've not gone through formal training except for what your probably your predecessor left you. So instead of guessing on job, you can sign up and have this done, and many more. We do risk management, validation, verification, and on the consultancy arm, if you need an audit, for internal audits, you feel like you need to know where you are in terms of quality management and just management and which areas you need to improve, you can just let us know and we come in and give you an audit, assess your needs, and then we shall be able to give a report. We also conduct research on behalf of organizations. Many of organizations have reached out to us and they feel like, okay, we want to base in Uganda, but we do not know where to start, or we want to do research in this area. We are able to do that. Accreditation mentorships are also available. And like I said, you are very lucky because we are also about to unleash our, we shall be unleashing our internationally recognized courses. So when you trust VIQAP, it's not about, are these courses real? Are they, will they matter? We are here to tell you that they matter, okay? Those are some of the services we offer. And then we have partnered with many organizations, that's the truth, but these are just some of them. We have already identified to you that one of our major partners is the Uganda Medical Laboratory Technology Association. And that's why for all the courses we do, they are CPD accredited. So when you attend such a course, we shall be able to reach out to you. You give us your details and your allied health number, and then these CPDs shall be able to update on your allied health. But these are just some of the partners that we work with, and some have not yet been updated. So we are very good at collaboration. We are open to collaborating to achieve a common goal. So that is basically about VIQAP consultancy services. We have upcoming trainings. You shall be seeing them in the slides, and we shall be able to, give you an opportunity to be able to sign up where you need, and ask. Always ask. The comment section is open. You can ask any questions that you need. I'm also here to introduce to us our trainer, who is Miss Nampeo Elizabeth. She's a quality manager currently at LMK, Medical Laboratories and Medical Laboratory and Consultancies Limited, which is currently maintaining ISO 15189 2022 accreditation on the new standard. So there is no better person to tell us what internal quality, control management should look like in the lab, than someone who has done it and been accredited on it. She gives more than 10 years experience in quality management, mentorships and facilitation. She is very experienced and an expert in the international standards on the ISO 15189, 17043, which is for proficiency testing, 17011, 15190, and 22367. She has done BBLT at Macquarie and DHSMA at UMI. But most importantly, Liz is passionate about quality management, and she's very free to share what she has learned over the years with us. So that is, when time comes, that will be our trainer for today. And without further ado, I would like to take this opportunity to invite Eric Okek, the president for UMLTA to speak.
Thank you so much. In a very special way, I want to welcome all of us for this very important meeting. Not actually a meeting, it's a training in regards to quality. So maybe for those who are not very conversant with the UMLTA, UMLTA stands for Uganda Medical Laboratory Technology Professionals Association. It is an association that brings together all the practicing medical lab professionals in Uganda in the areas of academia, research, and clinical practice. I think the association is almost older than all of us. It was founded in 1967, and it underwent a lot of, I like to use the word metamorphosis, through several stages of growth and development. And here we are. We are over 50 years old. Nonetheless, our key objective is advocacy and professional growth of our people. So the aspect of training CPD falls under the docket of professional growth. Just to bring us up to speed, in 2018, the Allied Health Professional Council mandated, not necessarily, delegated the role of coordinating CPD for medical lab profession to UMLTA. And as you're aware that UMLTA is a professional association, so we are not a programmatic entity, or neither are we a technical entity. So we sought to subcontract, if I can use that term casually, subcontract provision of CPD services to institutions that are legal and formal to execute such tasks. And VIQAP happened to be one of those entities. So when I was elected president last year in May, I think VIQAP already had some working relationship with the former administration of UMLTA under the leadership of my good friend Patrick Dennis Alibu, but they are not formalized. So when I became president, we worked around neck with neck and the VIQAP administration to have a formal memorandum of understanding with them. And I'm happy to let you know that we signed that MOU. I think in early May, VIQAP was the first institutional entity for UMLTA to have an MOU with. And we have maintained a very good cordial relationship with VIQAP. We have given them a platform to advertise, but also to synergize some of the effect so that they can reach the full audience. Now, for the past couple of months or even years, we have been trying to work on uploading CPD points, but there's been a relatively slow progress. I can authoritatively let us know that starting from this year, we shall upload the CPD points from accredited providers, and that include VIQAP. So, and you should have accumulated some minimal level of CPD for you to get either annual practicing licenses or to get what they're calling there is either a licenses or this other current document they're giving. Just keep skipping on my mind. Anyway, for you to register, get the license and extract, that's was looking for that word, extract. You must have accumulated some minimum level of CPD points. So periodically, we shall be contacting VIQAP to upload the CPD accumulated by individual participants, and we weigh if it reached the threshold. Obviously, there are also other partners, other providers, accredited CPD providers. So we shall merge all your CPD points and credit it on your systems. But like I said, it must reach a threshold. Yes. So Again, we are also in partnership with ALMA. I think we are supposed to have had a meeting to build the professional database. So that you guys can be accessed globally. So we put all your information so that someone in Turkey or Ecuador or Denmark can just punch in your name. And if they're looking for, say, a lab technologist from Uganda, you can be accessed globally. But also on that portal, we shall also have your CPD points uploaded. I can assure you that employers tend to look for those minimal CPD points. It's one of the interview criteria, selection criteria for jobs these days. I have been in so many interview panels, and it is very, very prudent that you accumulate some minimal CPD points. So as I wind up, as I wind up, I want to encourage all of us to wholesomely embrace the CPD program and also to officially let you know that VIQAP is one of our most accredited CPD providers, and they have held a very high level of professionalism. And so feel free to participate in the CPDs, and like I said, at the right time, we shall get the points that have accumulated and then credit it on your system. And I think we're also going to use ALMA to build like system interoperability so that the two systems of UMLTA, that of VIQAP and then that of Allied Health, can be talking to each other, so that when VIQAP upload, it automatically connects to your portal on the Allied Health Professional database. Yes. And my parting shot is a call for us to register with UMLTA. We have seen that we're no longer only a barking dog, but can also bite. In this almost 1 year of my administration, a lot of revolution has happened as promised, but we still have a challenge of low membership. So it's hard to advocate for bigger issues if you don't have numerical advantage. So our numbers are big. We're over 21,000 in the Allied Health Professional Council database, but let's harness these numbers to bolster the association's objective. Yes, so registration is simple, and I will ask anyone who wants to register can reach out to me or to Muingo, the SG. By the end of this year, if we can at least reach 5,000 registered members of the association, we can go a very long way. I am going to end my small speech here, and I wish all of us the very best of this training. Feel free to ask questions. I'm happy that my colleague Elizabeth Nampeo is an expert in this area. I'm very, very sure of our competence, but also of our enthusiasm in this area of IQC. Over to you, Viola, and the very best to all of us for this training.
Thank you so much. Thank you so much, Eric, for that. Without even adding a brick, when big men speak, you don't want to add, you may just dilute everything. But thank you so much for that message, and I'm glad everyone is here, team, in the right place. Elizabeth, I think right now, without taking any more time, kindly, you are welcome. You can share your screen with us and then take us away for the training. I'd like to invite Precious to lead us to lead us here on and forward. Let us know how much time we have, and back to you, Precious. Liz, you can take us away if you're ready.
Can you hear me now?
Yes, we can, loud and clear.
Are you still getting echo?
No, the echo is gone.
All right. You please, Viola, you will help me take up the notes. I'm unable to see the chat from my end.
That's all right.
Yes. Good afternoon, everyone. Good afternoon, colleagues. First of all, I would like to thank Viola for organizing this webinar on the most important topic in the execution of our laboratory diagnostics. Thank you, Eric, for your stewardship in UMLTA. Yes, the profession is going to where we want it to be. Thank you very much. So without wasting time, I've been introduced by Viola enough. I'm the quality manager of LMK, Medical Laboratory and Consultancies Limited. So I'm a quality assurance specialist and a national quality management system mentor under UNHLS. So what do we expect from this activity? So by the end of this webinar, all participants must be able to define internal quality control and its supporters, understand what the standard requirements are for internal quality control, be able to select suitable IQC materials, plot Levey Jenning graphs, and implement Westgard rules, and also be able to troubleshoot IQC failures using corrective action and preventive action measures. So internal quality control falls under the process control, quality essential. As we all know, the laboratory quality management system has 12 essentials, and process control is one of them. So under process control, we are going to talk about the internal quality control. These are some of the common definitions. I've tried to simplify them for us all to understand. So what is quality? Quality is a degree to which a set of inherent characteristics fulfills requirements. What does it mean? This means that for you to say that something is of quality, you must have defined the requirement to be met. So quality is not subjective, it is measurable. Quality assurance is a systematic approach to ensuring a product or service meets specified requirements and consistently fulfills customer and regulatory requirements. So in the lab, we have quality assurance procedures and quality control procedures. Quality assurance is a systematic approach. Those are the activities performed in the lab to ensure that quality is fulfilled. We also have quality control, which is a part of quality management focused on fulfilling quality requirements. Total quality control is a management system for customer-focused organization that involves all employees in continuous improvement. So this one comes from the total quality management framework, which is at organizational level, focused at continuous improvement and having a customer satisfied. What is quality management system? This is a system of business processes and procedures designed to consistently meet customer requirements and enhance their satisfaction. If you're to define the path of workflow for a laboratory, you find that it starts with a customer who comes with a request and also ends with a customer who receives the results, meaning that a quality laboratory service is indicated by a satisfied customer. And a satisfied customer is that one who has received a timely, accurate, and reliable result. Those three elements are one of the inherent characteristics that define quality. In internal quality control, you find that IQC is an internal procedure that monitors the testing process to verify that the system is working correctly and gives confidence that the results are reliable enough to be released. Internal quality control is marked by three measures: accuracy, precision, and bias in the middle. So accuracy is the closeness of a measurement or test result to the true value or a standard or an acceptable value. In other words, it's the trueness of a result. Precision is the closeness of two or more measurements to each other. It is the repeatability or reproducibility of results. So results might be precise but inaccurate, meaning that you can be off precisely, consistently, but not near the target or true value. And that one is usually caused by what we call a bias. A bias is a systematic, non-random deviation of measurement results from the true value. Sometimes you run IQC and you see all the results are on one side of the mean. That is a bias. It is systematic. It is not random. In IQC, when you're plotting an IQC chart, you're interfaced with the mean. The mean is the sum of all control values divided by the number of measurements. It acts as the target value for the assay. When you look at the IQC control sheet for the IQC material, you see that they give you the mean, the target value. So that's what we are talking about here. Standard deviation is a numerical value indicating the variability of the data from the mean. How far is the result deviating from the mean? That is standard deviation. And we are going to see shortly how we determine it. In IQC, we have rules that govern the acceptance criteria, and those are the Westgard rules. Westgard rules are a set of statistical patterns, each being unlikely to occur by random variability, thereby raising a suspicion of faulty accuracy or precision of the measurement system. And all these are governed by the ISO 15189 2022, the current version. And then lastly, we have what we call the total allowable error or total error allowable. These are performance specification limits predefined for a variety of laboratory analytes that define the maximum amount of error that is allowed for an assay when judging acceptability of a new assay during method verification or validation, evaluating patient or instrument comparison data, or in designing a quality control strategy. So we have a table called clinical laboratory errors allowable, CLIA limits. So that table can be accessible online, and you can see that every analyte has a total allowable error, such that even when you're doing your measurement uncertainty estimation, you refer to that total allowable error to see whether your precision is within the limits for you to judge that your assay is performing well or not. There is a relationship between the mean and the accuracy and precision. So the mean indicates accuracy. That's why for you to say that you're accurate, the results must be on the mean. And when they are above on one side of the mean, that is a systematic error. Whereas the standard deviation indicates precision, lack of random error. That's why we always say that we want to maintain our IQC values within 2 standard deviation. That way, you say that it's precise. But once it goes to 3 standard deviation, most cases it's a random error the first time it presents. Laboratories use the mean and standard deviation to establish control ranges. You remember that the IQC sheet comes with the mean and the standard deviation. So that is, you use that to establish control ranges. Westgard rules utilize the mean and standard deviation to identify significant errors, triggering the need for investigation, as we shall see. So why is IQC performance important? It's important for you to detect errors. It helps in detection of errors. It helps you identify random and systematic errors immediately, preventing error results from being reported. It is also part of process control to ensure that procedures are consistently performed according to high standards. So we have internal quality control procedures throughout the path of workflow, from pre-examination, examination, and post-examination procedures. Those checks at sample reception, they are internal quality control procedures. And then during the examination phase, usually we analyze IQC materials. And then the post-examination procedures have those review procedures for the results. So those are the IQC procedures at that level. So performing IQC is not only about running the IQC material, but you must have IQC procedures at all phases of the workflow. IQC helps to standardize procedures in the laboratory by aligning them to international requirements. For example, in the medical laboratory, we follow ISO 15189, but in a testing lab, they will follow 17 15025. And with the current version, 17025 and 15189 are having the same clauses for internal quality control. These are some of the excuses colleagues put up for not performing IQC. From my experience, most professionals say that QC material is too expensive. But have you ever thought of the cost of an error result? In this era where litigation is at the peak, no laboratory should compromise on IQC, because if you give out an error result, a patient can sue you, and you can only avoid that when you run IQC. Some say that the IQC cost will increase the cost of the test or product. I think about a time where you give out an error result, and then the cost it will take to the patient or to the organization. So we have some patients who undergo mismanagement, who undergo unrequired additional tests just because of an error result that came from a lab that did not perform IQC. There is always what they call value-based pricing. Quality is expensive, but it saves money. So IQC cost shouldn't be thought about to increase the cost of the test. Some say that it takes valuable time in the morning to prepare controls and run them when the clinic is busy. We all know that our patients report early, even before we arrive, most of the times. So it only takes someone who is professional enough to know that not doing IQC, I will not be helping this patient. Therefore, the time of running IQC is the most valuable time of the day. Some say that clients get angry when the results are delayed because QC is unacceptable. It's about explaining to the client that the cost of an error result is more expensive than a few minutes added to the turnaround time. Some say that there is no suitable IQC material on the market for a given test. This is true. Not all tests we do in the lab have IQC material on Ugandan market especially. That's why the standard took note of it, and they said try alternative methods. What does that mean? Stop making excuses. These are the guidelines of the ISO 15189 2022 7.3.7.2, which says that the laboratory shall have an IQC procedure for monitoring the ongoing validity of examination results according to specified criteria that verifies the attainment of the intended quality and ensures validity pertinent to clinical decision making. So whatever we are going to discuss today should be able to help you come up with an IQC procedure that you're going to implement in your laboratory for monitoring the accuracy of your results. It says that when you designing your IQC program, the intended clinical application of the examination should be considered. If your test is confirmatory, IQC must be at that level. If the test you're doing is screening, the same is true. The procedure should also allow for the detection of either lot-to-lot reagent or calibrator variation or both. Therefore, your laboratory procedure should avoid lot change in IQC material on the same day or run as either lot-to-lot reagent or calibrator change or both. The standard says that the use of third-party IQC material should be considered either as an alternative to or in addition to control material supplied by the reagent or instrument manufacturer. So the current version of ISO 15189 is a risk-based standard, unlike the 2012 version. This one requires that you assess the risk involved, and the impartiality principle is strengthened in this new version of standard. That's why they are recommending third-party IQC material, because it is independent. It is a should in this current version, but I know the next revision, it will be a shall. Shall means that it's a must. So this clause is preparing us for the future, that where we are going, third-party IQC will be a requirement for internal quality control. Because from practice, I've realized that some IQCs are forced to pass because the calibration material and the IQC material from the manufacturer are the same. So none checks the other. They are literally having the same matrix. So there is no impartiality. The standard further says that the laboratory shall select IQC material that is fit for its intended purpose. And then C, if appropriate IQC material is not available, the laboratory shall consider the use of other methods for IQC. So we are going to see the application of all these clauses. Let us start with the selection. According to the standard, we are required to follow the stability of the IQC material with regards to the properties of interest. So some analytes are unstable. For example, in a chemistry laboratory, electrolytes tend to be more unstable than the cholesterols, the lipids. So in that way, if you're selecting your IQC material, you need to look at the stability with regards to the properties of interest. Consider the matrix. Matrix means the composition of the IQC material. It should be close to patient samples. That's why most IQC materials, when you read about their content, some are plasma-based, others are serum-based. Even if it is for animals, at least it is close to the human patient samples. Unlike an IQC material that is made of other materials like plastics. Imagine if you're having an IQC material of microplastics. It means that its matrix is not going to behave the same way as blood. Consider the ability to react to the examination system or method as the patient samples or test items. You should always look at the insert of the IQC material. What are the instructions from the manufacturer? Instructions of use. If they tell you that run this IQC material in a different mode, on your analyzer compared to the patient mode. If there is an alternative, consider the alternative, which is run in the same mode as the patient sample. So there are some labs that have CBC analyzers that are autoloaders. You run the IQC using the autoloader mode and then run the patient sample using open mode. It means you're only controlling the autoloader mode, so you're not running IQC for the patient samples because the patients are run under open mode. Consider the ability to cover the concentration levels at or near clinical decision limits. If your laboratory, for example, is attached to a neonatal unit or a nephrology unit, such units have a tendency of having very high bilirubins. And from practice, the routine level 2s of chemistry, I think the highest I've seen is about 80. And you're reporting bilirubin of 200, 300, It means that your IQC that stops at 80 is not covering the concentration level of 200. So there you're advised to add their controls of high bilirubin. It means it is relevant to your laboratory. But if in your lab you don't routinely report such high levels and they are all within the limits of your controls, that is okay. If possible, consider the ability of the control to cover the measurement range of the examination method. Sometimes this is not easy to achieve, but where possible, it would be great because there all patients shall be covered. What is the frequency of IQC? IQC testing frequency depends on the stability of the test procedure, the risk of harm to the patient from an error result, and sometimes manufacturer's instructions. Why have I said sometimes manufacturer's instructions? Because manufacturers can recommend their frequency based on their environmental conditions. But when it comes to your lab and after your risk assessment, you might see that maybe the manufacturer's recommendation are minimal and you want to increase on the frequency. So what do we mean? Employ a risk-based approach to determine the IQC testing frequency and the appropriate QC rules. Not every QC rule can work for your laboratory. QC selection has to be guided by the risk involved with your test procedure, number one. It can also be guided on your method verification data. How was your precision when you calculated your precision, your repeatability? So if your precision was above, let me say the CLIA limits, or it was way above the manufacturer's precision, you might consider more strict QC rules for that given test. Every lab has a unique IQC testing frequency. However, the universal is at least daily, 24 hours. When we run our IQC, it is not about only running the material. There is more to just running IQC, and that is the data generated. That is what is most important. IQC data in a medical laboratory is best represented by a Levey Jenning chart. There are other charts like the X-bar graphs. Those ones don't bring it out well than the LJ chart. That's why for this presentation, we are going to base on the LJ chart. That is the most common. Levey Jennings chart is a quality control graph used in medical laboratories to monitor assay precision and accuracy over time. It plots daily control values against the mean to detect systematic shifts or random errors in test methods. It is therefore essential for determining if a test run is in control or out control, as we are going to see. Plotting an LJ chart starts with determining the IQC limits or ranges. It is always advised where possible to plot your LJ chart by yourself by determining the IQC ranges for your laboratory. But because of time, most laboratories use the automatically plotted LJ chart by the analyzer or an IQC monitoring tool. The third-party controls usually come with that IQC program that can help you plot the LJ chart. However, to have an accurate LJ chart, it is always advised to calculate your own mean and standard deviation. What does that mean? The mean and standard deviation on the manufacturer's insert is wide. They have considered all laboratories at all levels and with different competencies of staff, different equipment maintenance. So meaning there's a lot of bias contained in there. That for you to have an accurate LJ chart, it requires that you have your own mean and standard deviation. So we've said that you can get these from the manufacturer package insert. That is the easy way out. But the most accurate and desired is calculating your own mean and standard deviation. And it is simple. Run new control daily for 20 to 30 data points. It means you're going to run it in parallel with the current control material. You don't wait for the current load to get finished for you to start running the new one. So you're verifying the new control load against the current one. Calculate the mean and standard deviation for those 20 to 30 points. And calculating the mean is easy. Get the summation of the values obtained for each level at those 30 times, divide by 30. And then standard deviation, you just need to get the sum of the difference in squares, divide by the difference of the points, and then you square root. There you have gotten your standard deviation. After getting the mean and the standard deviation, you can now get to your computer, open the Excel worksheet and start labeling. Or you can get a chart paper and start doing the same. But now it is more sophisticated. We prefer using the Excel. Label the chart, name of laboratory, instrument and ID, test, units, IQC material, lot number. In other words, that is your title of your chart. Label the x-axis as time period and scale into evenly sized increments. So you label if it's daily, 1, 2, 3, up to maybe 30th or 31st. That is your x-axis. Label the y-axis as control value. That is where you're going to be indicating the control values basing on the limits calculated for your IQC material. On the y-axis, you put the mean, which is x, and then the plus 1 SD, plus 2 SD, plus 3 SD, some even go to 4 SD. Scale y-axis from lowest to highest. We are going to see this practically, and then write the values obtained. Your chart will look like this. You see the solid line is the mean, it is our x. And then we have the first trend line, which is the 1 SD up and minus 1 SD down. And we said that a control rule is a decision criterion to assess whether an analytical run is in control or out of control. It can be a single rule, like maybe 1,3S, or a multi-rule criteria, where you're going to use 1,2S, 1,3S, 2,2S at once when you're interpreting your chart. So you need to define what your analytical run is. Analytical run is the interval. It can be time or a group of samples for which a decision on acceptability is made. If you're a high volume lab, maybe reporting 1,000 samples per day, you can say that you're going to run IQC after every 30 samples or 50 samples. It means that your analytical run is 50 samples. But a lab that runs maybe 10 samples a day on average, they can say that their analytical run is 24 hours. So analytical run can be time or a group of samples which are monitored to make a decision. How do you choose QC rules? QC rules should be selected to maximize error detection and minimize false rejection. For example, if a lab puts their rejection rule at 1 SD, it means almost every day you're going to reject IQC runs. But if you put it at 2 SD, there's chance that a day will pass without rejecting a run. Consider the total allowable error of the test and the imprecision or inaccuracy of your method after verification. So measurement uncertainty is important in selecting the control rules. And also during determination of your IQC frequency, depending on the method used. If, for example, you use 6 sigma, 6 sigma has its definitions of how you're going to select your control rules. That if you have a 6 sigma of above 3, you're likely to use multi-rules. But if it is less, a single rule can work. And what are those rules we commonly use? They are the Westgard rules. Westgard rules, we have 1,2S, which is in control, accept the run. 1,3S, 2,2S, R4S, up to 10x. These are rejection rules. Let's see what each of them means. Westgard Rule 1S states that if a control is greater than plus or minus 3 standard deviations, it should be rejected and rerun. Most cases, this is a random error. So you want to rerun to see whether it is correctable. Westgard Rule 12S refers to the control rule that is commonly used with a Levey Jennings chart when the control limits are set as mean plus or minus 2s. This rule is used as a warning rule to trigger careful inspection of the control data by the following rejection rules. Westgard Rule 22S states that if 2 consecutive control measurements across runs exceed the same mean minus 2SD or exceed the same mean plus 2SD or within run, if 2 consecutive values outside the same 2SD, the run must be rejected. We are going to see this in a pictorial form. R4S applies to controls within run, where you have 2 controls exceed 4SD, or if one control exceeds 2SD and the other on the other side on minus 2SD in the same run, you reject the run. Westgard Rule 41S states that the run should be rejected if 4 consecutive control measurements have exceeded the same mean plus 1 SD or minus 1 SD. And Westgard Rule 10X, same as 6X, 7X, states that when 10 consecutive control measurements fall on one side of the mean, the run should be rejected, and that is a shift. So this is how these rules exhibit themselves on an LJ chart. 12S rule, you find that you run your IQC and then the plotting is slightly above the 2S. If it sits first time, it is a warning. But if you have it the second day, it ceases to be a warning. It requires investigation, as we are going to see. So when you have 2S, it is a warning. You don't rerun the IQC, but investigate other rules. If there is a 10x, if there's a 6x, there you have to investigate further. Westgard Rule 2 is the 13S. You run your IQC. On checking the chart, the plot is outside plus or minus 3SD. This is out of range. And if it's the first time, it is usually a random error. It is imprecision. And some of the causes for our analyzers, it might be pipetting error. Maybe as the probe was sipping, there was a bubble in the sample. That's why they always advise that before loading your sample cap on a chemistry analyzer, you need to be sure that there are no bubbles in the sample. This can cause pipetting errors. It can be due to poor mixing. If it's hematology, let me say CBC quality control, it might be poor mixing, and then you have very high values. What do you do when this happens? Reject the run, rerun IQC to see whether it corrects. If it persists, then it's no longer a random error, but a systematic error. In other words, you cannot proceed patient testing when this rule is violated and not corrected. Westgard Rule 3 is the 2-2S. This is what I talked about earlier on the 1-2S, that if it happens the second day, the second run, it's no longer a warning, it is a 2-2S. It is a systematic error. There are times when both levels have 1-2S. Level 1 has 1-2S, level 2 has 1-2S. It becomes a 2-2S because you're having two plots outside, two standard deviation in one run. So most times when people are reviewing LJ charts, especially where you have two controls or three, people forget that 1-2S on two controls becomes 2-2S. And they end up not rejecting the run, proceed, thinking that they were warnings, when actually it is a systematic error that requires investigation. Some of the causes of this 2-2S is usually a reagent lot or calibration change. That's why our standard said that your IQC must be able to detect lot changes. So sometimes when this happens, it is a reagent lot or calibration change. If you know that you've not changed the reagent or you've not calibrated, it means you might be running on wrong calibrator values, or your photometer lamp is deteriorating, or any other optic is having a problem. For example, in the CBC analyzers, there are times when the fluid baths get some dust on, and without maintenance, you might find yourself having most of the 2-2S rule violations. And all you need is to do a fluid bath maintenance and it gets corrected. What do you do when this happens? Don't proceed with patient testing, reject the run. Don't even rerun IQC, you'll be wasting resources. First, investigate the cause. Westgard Rule 4, 4-1S rule, where you have 4 plots consecutively on one side of the mean, on one side of 1-2S, sorry, not the mean, on one side of one standard deviation. It is a systematic error. A normal IQC plot must have evenly distributed plots. It's from a Gaussian curve that you want to have 95% distributed around the mean, and then you have the extremes on the two sides. So you want even distribution, not having plots on one side. Some of the causes is a reagent lot or calibration change, just like the 2-2S. What do you do? Reject run, investigate the cause. Westgard Rule 4, this is the one that usually shows us a shift. A shift is a systematic error. It is not random. It might be a 6S, 8X, 9X, 10X, or 12X. When the plots are on one side of the mean, it is a shift. It might be due to reagent load or calibration change. wrong calibrator values, deteriorating lamp, or competency issues. There are some lab techs who are not competent in reconstituting these controls. So you find that in a given month, an assigned tech has run IQC and all of them are on one side of the mean. Yet previously it wasn't the case. So sometimes it can be on the reconstitution, sometimes on the selection of the controls. There are some analyzers where previous lots of controls remain active. It is always good practice to inactivate the old lots of controls. So most times when you leave them active, when someone is running IQC and they are not keen enough to select the right lot, you might have these shifts. Reject run, investigate the cause. This being a systematic error, it means it's beyond the person, it's beyond the reagent, it includes the machine itself. So check the sampling system. How was the instrument maintained? There are some maintenances that are periodic, that if ignored, they result into shifts. Check the temperature of the room, the temperature of the analyzer itself, the calibration values, were they the right ones? Sometimes you change calibrators and forget to import new factors. Then the reagent lot, is it near expiry or already expired? You need to check. Sometimes the calibrator itself has expired. The values, the factors have expired and need an update. Some analyzers can flag calibration timeout, and when you ignore it, those are the shifts sometimes you see. And with shifts, it means you're releasing results that are skewed to one side. If it is 1 plus, you like it, or 2 plus, you like to have slightly higher results. If it is on the negative side, you like to have a negative bias in your results. So it is always good practice to also look at the trend of the results you're giving out for each analyte. We have the Westgard Rule 5, which represents a trend. This is usually 70. You have plots moving to one side, gradually increasing or gradually decreasing. That is a trend. It is a systematic error, usually to do with reagent deterioration or deteriorating lamp. Reject run, investigate the cause. Check the light source. Sometimes the lamp needs replacement. So it being dim might cause the results to go downwards. Reagent shelf life. Some reagents get expired on board or expire beyond their life. Control material expiry, water quality for water sensitive analyzers and electrolytes. So sometimes your electrolytes, the basic one, sodium, potassium chloride, might be showing that trend. So you need to check your water. If you're using distilled water that you buy, that one that is sold, you need to check is it really distilled. If you have an in-house deionizer, if your analyzer uses deionized water, you need to check the Siemens, the micro Siemens, are they within or they are outside? So sometimes the micro Siemens measurements for the deionizer might be out of range, and that is the only thing causing a trend, because you're introducing ions that are competing with the electrodes that have to test the electrolytes in your control material. So if that happens to the control material, you know that it is also happening to the patient sample. These are the errors in IQC. We've talked about the systematic error and the random error. Random error, these are factors affecting precision, temperature, poor mixing, poor technical skill, that is important. Then the systematic errors, we've talked about them, deterioration of instrument light for the trends, and abrupt changes in the control. You're changing a lot, you're likely to get some shifts. So when IQC fails, what do? You need to troubleshoot. First of all, hold patient sample testing. That is why it is good practice to do IQC before patient testing. Imagine you start testing patient samples at 8 and do IQC at midday. And then you find that you have this 3SD, 13S. It means that the results you will have given earlier are doubtable. So when IQC fails, hold patient testing, rerun the control with a fresh aliquot. That is usually the first thing. No more than 2 reruns should be made. If you run the first time, it fails, you only have one more chance to rerun. If it still fails on the second run, check the analyzer or reagent for problems. So follow the root cause analysis procedure of your laboratory and check for the possible causes. Record root cause and corrective action on the IQC log if you have it, in the IQC book, whichever your procedure has stated for recording such issues. Use root cause analysis techniques like brainstorming, the 5 whys, fishbone, Pareto chart, etc., depending on your root cause analysis procedure. When IQC failure is rectified, you've identified the cause and worked upon it. Randomly select previously tested samples for a rerun after corrective action. Subject them to a statistical test to check if clinically still acceptable using a total allowable error. In case they give discrepant results, all results done during that time are recalled and all samples are retested. If they are okay, if there's no discrepancy, no further action. So there are times when it is the IQC material that has the problem and there's nothing to do with the analyzer or reagent. It is always good practice to review the IQC results timely. You need to review the day's run. That can be done by the lab manager or section head. Before results are reported, someone must review that the run of IQC passed. It can be done, it must be done weekly. You need to review weekly for shifts and trends. And then the monthly review must be done by the quality manager or designee. So that is the IQC results review, basically to avoid ignored failures and also detect trends and shifts timely for investigation. Those are some of the materials you can read in your free time. The Westgard rules, you can check out the Westgard website. It has a lot on Westgard rules and IQC management. So Viola, over to you.
Allow me talk about the upcoming CPDs. Like for all of us who joined late in the chat, we introduced what VIQAP consultancy does. The people are bringing these webinars to you. So we basically do trainings. We do internationally certified trainings, nationally certified trainings, and also, awareness trainings. We train professionals in laboratory spaces, healthcare, and also other industries. But for today, we are focusing on the lab. We offer, let me say, ISO 15189-2022. What you have just studied now is just a snapshot of the lab, and we can all agree that this is just IQC. Now imagine there are other facets of the laboratory: EQA, personnel, management, equipment, just like Liz was talking about, the 12 elements of lab. So if that's something that you want to understand deep fully, we have trainings that are tailor-made for you. They are not expensive. Because we partner with organizations who enable us to subsidize the prices. So do not be left out. Do not be there and say, okay, I'm a very busy quality manager, I'm a manager, I'm a technologist, I've just gone out of school, or my lab has undergone accreditation, but there are some concepts I do not understand. Just reach out to us, okay? We do both personalized trainings and also, mass trainings like this. And if you do not follow us on our channels, Precious, who is our admin, we shall share the link in the chat so that you can be able to reach out, you can be able to follow, because this webinar has come out of a need. We've been running an IQC series on our channels, and by many of us learned a lot from there, and this is just like the climax, okay, of it all. So if you feel like you need more trainings and you need to keep up with, continuous professional development in different spheres of your professional journey, we are the people here for you. We have the ISO 15189-2022, which we are basing on for IQC today. It's a training coming in April, last week of April. We have the ISO 9001. This is for managers, okay? Managers, quality managers, founders, entrepreneurs. The 9001 is for you. It's the quality management system standard. You want to know what it recommends to do for better results. So all these trainings, we do them for better results and productivity, so that at the end of it all, like Liz said, quality management is about making sure your end client is happy. Most of us asked for the biosafety management training. We are partnering with the Ministry of Health to bring you this training. There's a link. These slides are going to be shared. So there's a link in that, on this slide. You just go ahead and click and then book your slot. For all these trainings, they are pre-ordered. We do not do a training if they are not trainees, but if you feel like you need to train, you just pre-order, and when the date reaches, we are able to give you the training. Then the most requested also is the laboratory leadership and management training. This one we bring together different people who have experienced laboratory leadership, who have walked the journey of leading a lab from grass to grace. They come and share with us what they've done, and also we have a standard curriculum from we have a standard curriculum on this from laboratory leaders. So people who have qualified and been certified in laboratory leadership come and give this training. Last but not least, sorry about my background, but last but not least, I've seen someone in the comment section asking about things like specificity, sensitivity, between run, within run, if it's something that you want to know, statistical processes, validation, verification, uncertainty of measurement, you want to know the statistics of the laboratory, we are bringing for you the validation verification training for your lab. So you can just order through the link or reach out on that number, and we shall be able to bring you trainings your way. But from us to you, we thank you so much for coming today. I would like to hand over to Precious. Precious, are you there?
Yes, I am. I'm present.
Yes, I hand over to you for now.
Okay, thank you so much, everyone, for joining us on this webinar today. We thank you all for creating that time to actually come and learn with us, to basically share knowledge with one another. Of course, set the links to our WhatsApp channel and community in the chat. So kindly please follow us. You can also follow us on our social media platforms. That's on X, we are VIQAP Consultancy. LinkedIn, that's VIQAP Consultancy Services. We're also on Instagram, we're also on Facebook, we're also on TikTok under VIQAP Consultancy. So please follow us on our social media platforms to get more updates, and also follow us on WhatsApp as well to get more updates from us and to find out what other trainings are happening, more events that are happening that are similar to this webinar that we've just had. We thank you all for sparing your time to learn with us, to train with us. To our trainer, Miss Elizabeth Nampeo, we thank you for sparing your time out of your busy schedule to speak to our laboratory professionals from different parts of Africa. Today we've had some people from Tanzania, we've had people from Kenya, we've had people from Mozambique, Zambia. We've had different people who have joined us, and we thank you all for joining us. So as we end, I will close with a prayer. Heavenly Father, we thank you for this day. We thank you for an opportunity to learn and to share knowledge of God. We thank you, Lord, for the knowledge that has been shared. And Lord, I pray that this knowledge that we have obtained, may we not forget it. May we continuously put it into practice, and may we not forget what we have learned. And may we also be able to share this knowledge with other people. In Jesus' name I have prayed. Amen.